A very warm good morning to one and all present here. It's a very wonderful day out there, and we are all here gathered to the Touch, Feel, Detect workshop on breast cancer awareness conducted by Fortis Hospital, Shalimar Bagh, in association with the University of Delhi. I welcome to the session Dr. Vinita Goel ma'am, Senior Director and HOD, Radiation Oncology. Professor Haneef Gandhi, Dean of Admissions. Professor Payal Mago, Director, Campus of Open Learning. I'd also like to welcome all the professors, non-teaching staff, and all the students gathered here to attend the workshop. Thank you. Now we'll start the enlightening session with the Kulkeed of Delhi University. I request you all to stand up for the Kulkeed.
सत्यम के मंगल दिव्य भावों का समागम
जयति जय जय जयति जय जय ज्ञान का आलोक अनुपम
भव्य महाविद्यालयों के परिसरों से चिर सुशोभित श्रेष्ठ गुरुजन कर रहे नित्य छात्र और छात्राएं दीक्षित
सदचरित्राचार पावन साधना संकल्प संयम
नवल वैश्विक चेतना नव क्रांति संस्कारों का उद्गम जयति जय जय जयति जय जय ज्ञान का आलोक अनुपम
श्रेष्ठ सुंदर दिव्य दिल्ली विश्वविद्यालय विहंगम
जयति जय जय जयति जय जय ज्ञान का आलोक अनुपम
ज्ञान का आलोक अनुपम
ज्ञान का आलोक अनुपम
ज्ञान का आलोक अनुपम
अब मैं मंच पर उपस्थित सभी अतिथियों से ये अनुरोध करती हूँ कि वो कृपया ज्योति प्रज्वलन के लिए मंच पर रहें।
हफ्ते में जाओगे चटनी तो नहीं बनाऊंगी सुनो चटनी तो अभी पुदीना है नहीं
Thank you. Now we'd like to felicitate our Honorable Chief Guest, Dr. Vinita Goel ma'am. She is the Senior Director and HOD at the Radiation Oncology, and she has majorly contributed to the breast cancer awareness. I'd also like to call Professor Haneed Gandhi ma'am to felicitate Dr. Vinita Goel ma'am. I'd like to request Payal ma'am to felicitate our chief guest. Thank you, ma'am. Now I'd like to felicitate Professor Payal Mago, ma'am. She is the director of Center of Open Learning. She is the heart and core of our School of Open Learning, and she has done major initiatives and programs for such. And I'd like to call up Meenakshi, ma'am, for the felicitation of Payal, ma'am. Thank you, ma'am. Now we'd like to felicitate Professor Haneed Gandhi, ma'am, Dean of Admissions. And I'd like to call up Akhilesh sir for Meenakshi ma'am itself for her felicitation. Haneed Gandhi ma'am has contributed majorly for the smooth admissions of University of Delhi. Thank you, ma'am. Thank you, everyone. Now I'd like to call up Professor Payal Mago ma'am for the opening regards and the brief of the session. Thank you.
Good morning, everyone. Are we still 1 minute to go? We have with us Dr. Vinita Goel, who is senior oncologist and is working in Fortis Hospital. On behalf of University of Delhi, I heartily welcome Dr. Vinita Goel to this workshop. And we have with us Professor Haneed Gandhi, Dr. Meenakshi Sahai, and Professor K. Ratnabali, who has just joined. On behalf of this whole program, I heartily welcome all of you and all the faculty members and other staff members of University of Delhi and students of University of Delhi. This is a very important workshop, and this important workshop, as it entitles, that touch and detect, identify, touch and detect. So, this is about the breast cancer. Now, why this workshop is important? First of all, I would like to congratulate Dr. Meenakshi Sahai for conceiving this program and organizing this very, very important program. If we go about the statistics, then it is not only in Asian regions, but all over the world. This is the second largest cancer which a woman gets, and sometimes it is not only women, it is targeting men also. Now, why it is the second, but it is now racing fast. The first very prominent cancer is the cervical cancer, but with the advent of different vaccines and recent detection techniques like pap smear and all, now it is controlling, it is on way of controlling, because there are so many vaccines, etc. They are developed for the cervical cancer. But cervical cancer, which was number one, now this breast cancer is running very fast. Now this breast cancer is something which might take up the first position. I think our expert is here, so she might clarify on this. This might take up the first position if we don't care about it. So this is a very simple thing that you can detect at home. You don't have to go to the hospital or do very elaborate tests to detect it. But if we are aware that this is the position, that how this can be detected, and this workshop will definitely tell us that we have to be aware about the breast cancer, we have to be aware about the detection technique, and we have to be vocal enough to discuss it with our family members. And it is not only for women. Now I can see so many men also, other male students also. We belong to a family where men and women both are equally contributing. But of course, the women is like more prone to this breast cancer. So, but as part of the family, we all have to be aware that this cancer can be curable. If it will not be wrong if I say that these workshops are very important thing. If we have to take care of our health, and if we can detect the cancer in primordial stage, primordial or primary level stage, then it is the first chance of prevention that the cancer will not happen, or we can detect it in the first stage or in the second stage. It is always better than to go for the secondary or the tertiary treatments. Usually what happens in India, there are certain social hitches also, that if a woman finds some lump or something like that in the breast, she doesn't like to talk about it to the family members for a very long time. Ki ho jayega, theek ho jayega. It might be a small outgrowth or something like that. So that hitch needs to be broken. That taboo, that social taboo needs to be broken. We have to be very, very careful, because this can be prevented, and if it is detected, it can be 100% curable if it is detected at the first stage or the second stage. And especially if there is a history in the family, that there is a history of breast cancer anywhere in the family, so it is very important that the female of the house must take care of herself, her elder generation and the younger generation to come. So these kind of workshops are very, very important, that these workshops, they give the awareness, they give you the hands-on training also, that how this can be detected at a very primordial stage, and this can save life of a patient, life of a woman who is facing this kind of a cancer. So we have to be very, very aware of all these kinds of things. This is actually important for our health. This is actually important for our not only our well-being, physical well-being, but also the mental well-being, and for the society, for developing a healthy society. So once again, I welcome all the members who are present over here. I welcome Dr. Vinita Goyal, who has taken out time for all of us from her very, very busy schedule. And when I was reading about Dr. Vinita, I was able to get so many compliments for her from international patients also, who are coming to her for treatment, etc. So I welcome you, ma'am, on behalf of Delhi University, and I think this is going to be a milestone in maintaining the health of women, and in maintaining the health of our employees also, and this will help us in primordial and primary detection of the breast cancer. Thank you so much.
Thank you so much, Payal ma'am, for such an informative introduction. So now we'd also like to felicitate K. Ratnavali ma'am for her beloved presence. I'd also like to call up Meenakshi ma'am for her felicitation. Thank you, ma'am. So now we'll start the session, and I'd like to welcome our beloved chief guest, Dr. Vinita Goyal ma'am, for speaking on the session.
So good afternoon, everyone. I feel extremely honored, to be a part of this August gathering. And I want to thank all the faculty who are present here, especially people like Madam Meenakshi, who've taken all the efforts to organize this important workshop. I'm sure I would leave you with a lot of theoretical information as well as practical information, which you can carry with you, and, share it with your other friends, family members, and everyone. So I like to tell stories. We'll start with some stories. Sure. So I'm sure some of you must be wondering, why are we talking about cancer? There are so many other good things that we can talk about. Why talk about cancer? Who is at risk of cancer? I'm just coming from my OPD. I saw a 39 years old lady, mother of 2 children, married at the right age, breastfed her children. There is no family history. She's absolutely fit and fine. She had breast cancer, and her husband, could not stop himself from asking me this question, why did she get it? I did not have an answer. So I feel that cancer is like an accident. We are all prone to accidents. I'll just give you one small example. Suppose you're going and you're driving from Delhi to Jaipur, and you're doing a lane driving, you're driving at a speed of 50, you're wearing a seat belt, and your car is nice, etc. Everything is perfect. Still, there is a small risk of accident. Suppose there is another person who's driving very rash, not doing lane driving, not obeying all the laws, then that person is more prone for accident. Same is true for cancer. If there are people who are smoking, people who are taking alcohol, they are more prone to it. Does not mean that a person who's leading a very healthy life cannot get it. I don't want people to go away thinking that even if somebody is not smoking, not taking alcohol, can get cancer, then, I might as well enjoy my life. You're making yourself more prone to it if you're not taking care of these things. So we are talking today about cancer. Professor Mago has just said the right words by saying that we all must be aware about it. So anyone and everyone is at the risk, and early detection is the key to cure and survival. I'll give you another small example. We work in hospitals. So there comes a patient whose blood sugar is about 150, and the patient goes and sees a diabetologist. What will diabetologist say? He will say, go and, control your weight, have a healthier eating habits, and you don't need any medicines. Suppose the same person's blood sugar or diabetes is detected at the blood sugar of 250, then he or she will require oral tablets. Suppose it is 400, then insulin. Suppose it is 500, then hospitalization. Same is true for cancer. Any disease, from diabetes to cancer, if picked up early, will require lesser treatment, lesser cost of treatment, lesser side effects of treatment, and much better results. Compared to that, if we detect a cancer in stage 3, then more treatment, more expenses, more side effects, and lesser outcome. So that is why all of us have to become aware as a society to avoid it, to prevent it, as well as for cancers which are not preventable, we must detect them early. A lot of people keep thinking, that I lead a very healthy lifestyle, I don't have a family history, so probably the cancer cannot touch me, while that is not true. We all see all these celebrities, we keep hearing about them. From Lisa Ray to Monisha Koirala, everyone, Sonali Bendre, cancer is knocking at the doors. So that is why all of us have to remain aware. Remember, COVID came suddenly. We were not prepared for it. So that is why we were struggling to manage it. So anyone who says that I am health conscious in today's day and era also needs to be a bit conscious about health. It is very common, especially in Delhi, that on Sunday if you go, that a lot of people will be lined out outside the labs and they will be checking their blood sugar, cholesterol levels, etc. That's fine. We must do that. I am not saying that you should not. But then at the same time, we must also check for some more serious problems which are increasing in incidence. Earlier, when I was doing my post-graduation about 25 years back, we were taught that lung cancer occurs only in smokers. Women and lung cancer was not seen. But now we see a lot of non-smoker, which means women who do not have history of active smoking or second-hand smoke. Their partners also do not smoke. Still they get lung cancer because there is so much of pesticides in our food, in whatever water we drink. There is so much of pollution. There is so much of stress, which is all contributing to lung cancer also, which was so unknown. Similarly, mouth cancers. Whenever I have tried to talk about the causes of mouth cancer, I have been told to shut down. Mouth cancer, I see at least one woman or one gentleman with no history of tobacco or alcohol use getting mouth cancer. My youngest patient these days is 36 years old. He comes from Dubai. There is no history of tobacco use at all. His only problem was that he used to eat food very fast, and he had this habit that he would often chew his tongue. He would bite his tongue. That constant bite of the tongue led to the trauma, which ultimately converted into cancer, which means all of us have to remain aware. My own Masi, my mother's younger sister, she used to have dentures, but over the years her face configuration changed while she kept on using the same denture, and that denture kept hurting at one point, and that constant trauma led to cancer, which means the causes of cancer are several. So even if you have a very healthy lifestyle, you are a non-tobacco user, you do not have a family history, still all of us have to remain aware. Mrs. Margot just pointed out that the cancer incidence is rising. Definitely cancer incidence in India is on rise. What is surprising is that if we look at the US statistics, then majority cancers occur after the age of 50 or 60 years, while in India, young population with cancer is increasing, and that is something bothersome, and that is why I am glad that you have students also as audience who can take away the correct message. So I'll just play a small video. This is a video of one of our patients. Her name is Mrs. Shimona Talwar. Shimona was a young engineer. She is a young engineer. She was doing her dream job in Germany. She was living there with her husband. She was pregnant with her first child. What can be better? What can be better than this? And then, in the second trimester of her pregnancy, she was diagnosed with breast cancer. Husband and wife immediately rushed to India because she was pregnant. She could not go through the entire gamut of tests which were required, because we had to respect the fact that she was pregnant. She went through selective tests. Now there are chemotherapy medicines which can be given even during pregnancy without harming the baby. So she went through some of those chemotherapy drugs. Then she had early premature delivery of the baby. And then she underwent a PET scan. And then she underwent surgery, chemotherapy. She's fine today. So I'll just show you a woman of grace. At the end of the day, I do not want you to get carried away with the message that cancer, as was shown in the movie Anand, is a death sentence. It is not. Madam Margot just now correctly said that if detected very early, then the cure rates are very high, and that is the aim of this meeting today. The sound is not heard. Can I also request you to dim the lights of the auditorium?
नहीं
The sound नहीं आ रही.
माना के मुश्किल है सफर पर सुबह मुसाफिर ओ कहीं अगर तू रुका तो मंजिल आएगी ना फिर कदम कदम मिलाए जा गगन गगन झुकाए जा रख हौसला कर फैसला
I still get goosebumps whenever I watch this video. I have seen Shimona going through this entire treatment journey and the journey of motherhood. That is why all of us are here today, to raise awareness. I had another lady come to me. Her name is Akanksha. Akanksha was feeding her baby when she felt a breast lump. She went to a gynecologist. Gynecologist thought that it could be because she's feeding the baby. But the lump kept growing and she felt uncomfortable. She got an ultrasound done. She was diagnosed with breast cancer immediately after her pregnancy. No age is immune. No person is immune. However healthy we all may be. That is why all of us have to remain aware. Now, a lot of people ask me this question, why cancer is becoming a more common disease. There are reasons. So let's look at those reasons. One is that our aging is increasing. Earlier people used to get old at 60. Now at 70, 80 also people are fine. Now with urbanization, we all have modern cars and gadgets, so the physical activity is reducing. There is industrialization, which has led to the seepage of chemicals in our environment, including our water and food. The other problem is our changing lifestyles. There is lesser physical activity, delayed marriages, no or lesser children, changing diet pattern, which is a big thing. I think जो मम्मी के हाथ का खाना होता है, जो हमारी किचन से खाना आता है, that is safest. Earlier, the tobacco and alcohol was not so easily available, not so easily accessible, and there was some barrier, Now all those barriers have opened. The education is a right thing, but the liberalization which has come with the education, we are paying some price related to that also, because the accessibility has increased. And I want to tell you that cigarette smoking or use of tobacco in any form can not only lead to mouth or throat or lung cancer, it can lead to plethora of cancers. So then we have to make sure that we ourselves and our younger generation stay away from any form of tobacco. Tobacco is not one chemical. It has multitude of harmful chemicals which not only cause cancer, they damage our kidneys, lungs, heart, everything. So we have to ensure that we all stay away from it. The new thing or the new fad is the e-cigarettes. I'm sure you all must be aware of it. E-cigarette looks like a very fancy pen, and a lot of youngsters have started believing that e-cigarette does not contain nicotine and it is harmless. Let me tell you, the incidence of lung cancer suddenly rose in China as their practice of e-cigarettes increased, and they actually banned it. USA banned it, while India has become a dumping ground for things like e-cigarettes, and we have to make sure that our younger generation stays away from it. When I go to schools, a lot of teachers tell me that even school students these days carry e-cigarettes. It is absolutely harmful. Make sure that our kids stay away from it. Alcohol also leads to multiple kinds of cancers, so we have to stay away from it. So whenever we talk of cancer, I also over-exaggerate and talk about smoking and alcohol as the main cause of man-made cancers. But then we all have to understand the times are changing. Poor eating habits, junk and processed food, what is the junk food? Any junk food is a food which is laced with a lot of sugar, unhealthy fat, preservatives. They are all leading to obesity, insulin resistance, inflammation in our body. Earlier, we used to say that liver cancer occurs because of alcohol. Now then came the era when we started saying that it also occurs because of hepatitis B infection. Now we are in an era where we see a lot of women and men come to us with liver cancer without any history of hepatitis or alcohol consumption, because it is related to their metabolism, which is directly linked to the food which is being consumed. So it is called as metabolism related liver cancer. So we all have to ensure, we all have to go back to our own household kitchens and ensure that we are eating healthy diet. And healthy diet means more plant-based diet. That is the healthiest form of diet. We have to avoid all kind of packaged and junk food and ensure that we are physically active. Any activity that you like. You like to run, dance, yoga, take stairs, whatever. Even if somebody is not losing weight because of the physical activity, exercise or games or sports, etc., that's fine. If you're doing physical exercise, that will keep your body healthy, keep you away from diabetes, blood pressure, cancer, everything. And let's not confuse activity with exercise. Exercise is different and activity is different. Suppose I'm doing work in the university and all day I am on my 2 feet. That is activity, that is not exercise. So we all have to ensure that we have some form of exercise as a part of our daily routine. I'm often asked this question, what are the early symptoms of cancer? मैं आपको यहाँ ये बताना चाहती हूँ कि कैंसर के अपने कोई symptoms नहीं होते. तो मैं आपको एक ट्रिक बताना चाहती हूँ जिससे अगर किसी को कोई सिम्टम हो और डॉक्टर के पास जाने की कब जरूरत है. कैंसर के क्या सिम्टम्स हैं? कैंसर के सिम्टम्स अगर ब्रेन ट्यूमर है तो हेडेक है, बैक पेन है, चेंज इन वॉइस है, कांस्टेंट कॉफ है, लॉस ऑफ एपेटाइट, लॉस ऑफ वेट, गला खराब होना, आवाज में चेंज होना, ये तो सबको होता है. सो द ट्रिक इज दैट इफ एनीवन हैज एनी ऑफ दीज सिम्टम्स which are persisting, not going away. 2 weeks हो गए, 3 weeks हो गए, आपने डॉक्टर को दिखा लिया, आपने अपना घर का भी अपना लिया इलाज जो भी करना था. If it is not going away, it is time to go and see your doctor. No, because cancer does not have its own symptoms. अगर कैंसर के अपने कोई सिम्टम्स होते तो आज टाइम मैगजीन के फ्रंट पेज पे आ गया होता. आप सबको, हमें सबको मालूम होता कि अच्छा ये सिम्टम है, then I need to rush to the doctor. Suppose somebody is, as Madam Mago was mentioning, that for a long time, I have worked in villages also. Women used to think that when they had breast lump, it is fine to have breast lump. It is not fine to have breast lump. What they would do is they would confide in their mother-in-law, sister-in-law, who would reassure them. Now all those times have gone away completely. If you have a problem, better deal with it proactively. Now, with this general information about cancer, I'll switch the gears and talk mainly about breast cancer now. Breast cancer, Professor Mago correctly said, is superseding the numbers of cervical cancer, largely because for cervical cancer, some vaccine has come. How many of you know about the cervical cancer vaccine or have given it to your children? Very nice. At least there are a few hands which are being raised. I'm glad about that. May I also ask you in the same breath, how many of you above 40 years of age, women, have done a mammogram for themselves or consider doing that as an important part? So I can imagine that there are a lot of youngsters also in the audience. So that is why there are few hands raised, but I'm glad that people are aware. So what is breast cancer? Breast cancer is a cancer which which arises in the breast. This is showing the breast cancer incidence in India according to the age. You can see that majority breast cancers occur above the age of 40 years, but in India, the young women with breast cancer is increasing. That is why we all have to remain aware about it. There are some myths. People think that consuming caffeine, using deodorant, heating food in microwave, cellular phones, etc. cause breast cancer. These are all wrong. Don't get carried away by this. There are 2 causes of breast cancer: genetic and environmental factor. Genetic factor is very small. Thankfully, it is very small. Less than 5% breast cancers occur in family. अगर फैमिली में रन होने लगता ब्रेस्ट कैंसर तो सोचिए नंबर कितना बढ़ जाता. थैंकफुली ब्रेस्ट कैंसर मेजरली फैमिली में नहीं रन करता. सो अब एनवायरमेंटल फैक्टर्स की बात करते हैं. एनवायरमेंटल फैक्टर्स में 2 तरह के फैक्टर्स हैं, नॉन मॉडिफाइबल फैक्टर एंड मॉडिफाइबल फैक्टर. So non-modifiable factor is being women itself is a risk factor. You can't do anything about it. We are happy being women. As the age advances, the incidence of breast cancer increases. You can't stop aging. Early menarche and late menopause leads to more estrogen exposure. Again, you can't do anything about it. So these are environmental factors which are non-modifiable. Let's look at what is in our hands. What are the modifiable risk factors which we must avoid? Sedentary lifestyle, alcohol consumption of oral contraceptives. These are some of the factors. These factors are increasing in our society. The other factors are late marriages, not having children, having fewer children, not breastfeeding, poor diet. These are other factors. जब मैं कहीं जाती हूँ तो मुझसे अक्सर लोग सवाल पूछते हैं कि ब्रेस्ट कैंसर के अगेंस्ट कोई वैक्सीन आ गई या नहीं आ गई. तो मैं उनको बताती हूँ कि ब्रेस्ट कैंसर के अगेंस्ट जो वैक्सीन थी वो तो बहुत पहले ही आ गई थी. वो हम सबके पास है. That is timely marriage, having children and breastfeeding. How does it help? When a woman breastfeeds, सो उसका ईस्ट्रोजन लेवल ड्रॉप कर जाता है. So there is lesser estrogen exposure to the body, and that is why the incidence of breast cancer comes down. So then the next question is, what is adequate breastfeeding? Minimum 1 year breastfeeding is considered adequate. If someone can do more, then it is always better, but that is best. And what is the definition of this early marriage and how does it matter? Why it matters is, suppose there's a lady who's getting married and pregnant at the age of 25, then at young age, her estrogen levels are coming down. Suppose the same lady bears a child at the age of 30, 32. Then by 30, 32 years of age, till that age, she's continuously had estrogen exposure. So I think sometimes it is better to be retrogressive rather than always be progressive. We need to rethink. Our girls, our daughters have to marry in time. The breastfeeding has to be promoted. Breastfeeding for a long time. Majority of us are working women. Probably government should also consider giving a longer maternity leave so that women can comfortably breastfeed their children. Now I repeat, the vaccine against breast cancer is breastfeeding. The vaccine against breast cancer is yoga. The vaccine against breast cancer is having a healthier lifestyle, having a home cooked food rather than outside food. This is again just to re-emphasize what I said earlier. So these are cure rates. Suppose somebody gets a breast cancer in the stage 0, then the cure rates are 100. If it is in stage 3, then the cure rates drop to 45 to 50%. So early detection is the key. We have to prevent. What cannot be prevented must be detected early. So this is the picture of a wife of ex-president of USA. Her breast cancer was diagnosed at the age of 66 years, stage 0. She required very less treatment and she lived a normal life. She died at the age of 97 years, natural death, unrelated to breast cancer. That is the advantage of early detection. Let me tell you another story. In the middle of the COVID, this lady came to us from Sonipat. She felt a breast lump. मुझे ढूंढने में मुश्किल हुई, जो आंटी को खुद फील हो गया था. मैंने उनको पूछा, मैंने बोला कोविड चल रहा है, आपको ऐसा क्या इम्पोर्टेंट लगा कि आप अपने बेटे को लेके, जब कोविड में घर से बाहर नहीं निकल रहे थे, हॉस्पिटल जाना बहुत दूर की बात, आप आ गई. उन्होंने कहा, बेटा मैंने अमर उजाला में पढ़ा था कि 50 साल की एज के बाद अगर कोई ब्रेस्ट में गांठ होती है तो वो नॉर्मल नहीं होता, उसको इग्नोर नहीं करना चाहिए. हैट्स ऑफ टू हर. Not very educated, not very affording. This is the kind of awareness that we need in society. I've been working in Delhi for the last 15 years. Earlier, before coming to Delhi, I was in Mumbai. And one big change which I found when I moved from Mumbai to Delhi was Mumbai women were much more aware. We have to create that kind of a society. We all have to be aware of our own breasts. So that brings us to another question: that what can we do to detect the breast cancer right when it is there, and not get delayed. So there are 3 approaches which help in early detection of the breast cancer. I would request men in the audience to also pay attention to what I'm saying, so that you can go home and share the information with your women folks in the family. So the 3-pronged approach which is required for early detection of breast cancer starts with us. The finger is pointing towards us. Self-examination. We are a closed society. हम कभी बात ही नहीं करते इस बारे में, self-examination के बारे में. We have to talk about it with our daughters. Breast self-examination. Once in a year, there is an X-ray of the breast which is called as mammogram. It should be done at least after the age of 40 years. And once in a year, we all have to get ourselves checked by a doctor as well. So mammogram, as I just now mentioned, is a kind of a X-ray. अगर किसी की फैमिली हिस्ट्री है तो आपको अपनी किस एज पे मैमोग्राम स्टार्ट करना है वो अपनी डॉक्टर से डिस्कस करना पड़ेगा. जनरली क्राइटेरिया ये होता है कि अगर सपोज मेरी बहन को 35 इयर्स की एज में ब्रेस्ट कैंसर हुआ, देन आई मस्ट स्टार्ट 5 years earlier. देन आई विल स्टार्ट माई स्क्रीनिंग एट 30 years. If I do not have a family history, then I will start with the mammogram after the age of 40. But between 25 to 40 years, at least I must do self-examination and consider getting a clinical breast examination done. So मैं breast cancer self-examination के बारे में डिटेल में बताऊंगी. अगर किसी को अनकंफर्टेबल लगे देन आई एम एब्सोल्युटली ओके, यू नो, कि अगर आप कोई निकलना चाहें तो. So breast self-examination should be done by women once in a month. The purpose is to familiarize ourselves with the look and feel of our own breast. जब पीरियड्स चल रहे होते हैं तब हम मना करते हैं ये करने के लिए, बिकॉज उस वक्त थोड़ा ब्रेस्ट टेंडर और सोलन होती हैं. सो इट शुड बी डन 5 to 7 days after your periods are over. For women who have attained menopause, I suggest that you can fix a date or day of a month, every first Sunday or every second or whatever, you know. Fix a day so that you do it every time. There are two parts to self-examination. First, we have to look at ourselves and then we have to feel ourselves. While looking, I'll do a practical demonstration because I've got some models also, जिसमें आपको touch, feel and detect वाला हम आपको explain करेंगे. So if you want, I can take this part also little later also. Professor Mago, what do you say? I can carry on. No, you have to tell me. It's okay. Okay. So we have to look at ourselves and then we have to feel ourselves. While looking at ourselves, we should be standing in front of a mirror. The room should be well lit. Normally, both the breasts are symmetrical in size, shape, contour, etc. If you feel that there is any bulge or dimpling or any change in the position of the nipple, one nipple is going inside or is projecting outside, then that is the time, or any redness, soreness, etc. That is the time that you have to consult a doctor. While you're looking at yourselves, keep your arms by the side and then raise your arms. You have to see whether both the breasts are being elevated similarly in a similar fashion when you're raising both the arms, and if there is any fluid coming out of the breast, and then one needs to feel the breast. For feeling the right breast, you will use the right hand, and for feeling the right breast, you will use the left hand. When you're feeling your breast, you do not have to hold the breast, you have to press with your middle 2 or 3 fingers. These are the pulps of our fingers or the pads of our fingers which are very sensitive. You have to feel your breast in a very systematic manner, start in clockwise manner from inside outside. Do first inner circle and then outer circle. Feel the entire breast. Feel your armpit. This is our collarbone. Feel above the collarbone also. You can do it in 2 positions. Either you can do it in lying down position, or some women find it easier to examine themselves while they are taking shower, that there is privacy and then there is some water which helps you feel it easily. My suggestions are, don't do it in a hurry. Don't do it in the middle of something very important that you are occupied and you suddenly remember and you start doing that. Don't miss any step. Both look and feel are important. Don't hold the breast tissue. You have to use the pads of the middle 3 fingers, place them horizontally and then feel your breast. Where the breast mount is thicker, you will need to apply more pressure. Where the breast mount is thinner, you will require less pressure. And if you feel anything, don't panic. The breast is related to the hormones in our body. In a younger age, a lot of women will feel that, you know, when their periods are coming, then the breast feels heavy, the breast feels nodular, it feels a little painful, but then the pain and the nodularity disappears once the periods are over. That is a normal hormonal change. Majority breast lumps are not cancerous. So that is why I am again saying that when you are examining yourself, please do not panic if you feel any abnormality. So in these pictures, we've tried to show what kind of abnormality you can find. You can see in this. Okay. So look at this. This breast is bigger in size than the normal breast. Or if there is any lump or thickening in the breast, then that is abnormal. If there is any change in the texture of the skin, I will show you, I will demonstrate what I mean by change in the texture of the skin. Or if there is any redness or rash around the breast or the nipple, this is abnormal. Or if the nipple gets pulled inside, this is normal. If the nipple gets pulled inside, that is also normal. Or if there is any nipple discharge or redness in the breast or in the armpit or above the clavicle, all these are the signs for which you need to probably go and see your doctor without panicking. I'm sure some of you must be having some questions in your mind. When we do the practical demonstration, I'll try and answer as many questions and give more clarification. So hold on with your questions. So I thought that I might use this opportunity because there are a lot of teachers in the audience, there are a lot of mothers in the audience. I would also briefly like to talk about cervical cancer. we all know that smallpox has been eradicated from the world. How could smallpox get eradicated? It was eradicated because there was a vaccine available and there was a door-to-door campaign for many years. Now for cervical cancer also there is a vaccine which has become available. It is available in India also. It has no side effects, and WHO has given us a mandate that in next 15 years, by 2040, we have to eliminate cervical cancer from the world. Imagine, the number 2 cancer in the women can be eliminated, so we all must remain aware about it and make an attempt to, be a part of that movement to eradicate cervical cancer. Cervical cancer is very less talked about. Breast cancer is more talked about because a lot of people think it is a taboo topic. People think that it occurs in women who do not have a normal sexual life or some perverted sexual life, while all this is not true. So let me begin by explaining you what is cervix. So just see this anatomical diagram. This is uterus. Uterus is our baby bearing organ, which is connected with the birth canal through which the babies are delivered or born. The center portion between uterus and birth canal, the junction between the two is called as cervix, and the cancer arising from cervix is called as cervical cancer. Cervical cancer, unlike breast cancer, is caused by a infection, by a human papilloma virus or HPV infection, and that is why there is a vaccine available against it. Breast cancer is not caused by a bacteria or virus. It is the play of hormones in our body majority times. So that is why there is no vaccine. Now, there are some signs and symptoms of cervical cancer. Any abnormal bleeding, any post-menopausal bleeding. A woman has achieved menopause and she gets bleeding or excessive discharge or having periods between the 2 cycles, having abnormal bleeding. These are some of the symptoms which, if any woman gets, must see the doctor for a consultation. Now, for prevention of cervical cancer, we generally recommend that it should be safe sexual practices with single partner, using barrier methods or condoms, limiting number of pregnancies. The pregnancies anyway have become very limited, I think. We must, for women who are above the age of 35 to 40 years, must do a very simple test which is called as PAP test. PAP test is done on OPD basis. You go and see a gynecologist, they will examine you, take some fluid through your vagina and cervix and send it to a laboratory, and then we will know the results. It's a very, very simple, completely painless test and can be easily done. Once the report is normal, then you need to repeat this test after 3 to 5 years. The other big change is the availability of vaccine. How many of you have children in the age group of above 9 years? Okay. How many of you have girls above 9 years? Okay. How many of you are still under the age of 40 years? Please listen to this carefully. Now we have HPV vaccine which is available. Earlier the vaccines were made only in the foreign countries. Now Serum Institute of India has made these vaccines are being made in India. The Indian vaccine comes by the name of Cervavac. The earlier vaccines which we were using were Gardasil, and there's another one. For women, for girls in the age of 9 to 15 years, 2 doses are enough. You don't even have to wait for their menarche to start or their periods to start. Above the age of 14 years, 14 to 40 is generally what we say 3 doses are required. These doses have to be given at 0, 1 and 6 months. These vaccines give 70% protection. Let me remind you, COVID की vaccine हम सब ने line में लग के ली थी 60-65% efficacy के लिए. Here you have a vaccine which is giving protection against cancer. Number 2 cancer in women. It is our responsibility and duty. See, we have a large population. That is why probably our government has not been so far successful in introducing these vaccines as free vaccines under universal immunization program. We expect that now, since the vaccines are being manufactured in India and the cost has significantly come down, in upcoming times the vaccine will be introduced as free vaccine under universal immunization program. Till then, I would suggest that we must take vaccines ourselves. It is preferable to give it at as young age as possible, certainly before the girls get married, Now there is a recommendation which is coming that the boys must also be given this vaccine. So even if you have young boys, they must be given vaccine. Vaccine not only protects against cervical cancer, it actually protects against vaginal cancer, anal cancer, a lot of warts, viral warts, etc. So it gives a lot of protection. So the vaccines have to be given. What is the upper age limit? The upper age limit is 40 years. It is always preferable to give it at a younger age, but it can be given up to the age of 40 years also. Then that is called as catch-up vaccination. Somebody is missed taking this vaccine can also consider taking this vaccine up to the age of 40 years. What is important is that if you're taking at after the age of 14 years, then the person will require 3 doses. The 3 doses will require 6 months. During those 6 months, pregnancy should not be planned. So I think with this, I would like to stop discussing more about breast cancer. My final message is prevention and early detection. Women must do their mammograms, pap smear, vaccination. For men, there is a test which is called as serum PSA, prostate specific antigen, because PSA is a common cancer in men. Lung cancer is again a common cancer in men. For early detection, there is a CT scan which is called as low dose CT scan, which should be considered once in a year. Both must stay away from smoking and alcohol. Vaccinate your kids, vaccinate yourselves, and encourage yourself, your spouse, your siblings, your friends for regular health checkup. हम सब अपनी कार को तो भेज देते हैं सर्विसिंग के लिए, अपनी सर्विसिंग रह जाती है. उसके लिए हम सबको ना कोई एक डे फिक्स करना पड़ता है. प्रायोरिटीज, नथिंग एल्स, है ना. अगर मेरी प्रायोरिटी है कि मुझे आज मूवी देखनी है, तो मैं हॉस्पिटल का काम खत्म करके जाके देख लूंगी, है ना. So somewhere I think our health also has to become our priority. This is our women campaign, which we call Nidar Hamesha or Hausla Hamesha, where women who have gone through this journey of breast cancer or other cancers, they come out, they talk about it. They do not want to hide themselves. I'll show you, because it is our duty to remove the stigma. So I'll close with this last story. So this lady, her name is Mrs. Nisha Jain. Nisha fought 2 cancers. She initially had colon cancer, underwent surgery, chemotherapy, recovered. Few years later, she had uterine cancer, required surgery, radiation, but she's unstoppable. This is all after her cancer treatment. Every year, she runs Delhi Half Marathon. She loves adventure sports. She wanted to see the Valley of Flowers. She's only 65. And she wanted to see this Valley of Flowers, decided to go for this hiking trip all by herself. She refused to take any family member along, thinking that once she gets tired, they will say, "Ho gaya, chalo ghar chalo." So she didn't want to stop. Her name is there in the Limca Book of Records. When she was 64, she used to do 64 Surya Namaskars daily. Now she's 65. She does 65. So with aging, she's increasing her stamina and her zeal to do yoga. This is the Valley of Flowers. I think these women or these men have seen life and death much more closely. They value life much more than all of us. They live a better life. She's Akanksha, I was just talking to you about. So Akanksha का जब ट्रीटमेंट चल रहा था, तो she had breast cancer, तो hair loss हो गया था. तो हमारी एक पेशेंट फॉलोअप पे आई जब उनका ट्रीटमेंट चल रहा था, तो आकांक्षा जाके उसके हेयर पुल करके देखती थी. I said, आकांक्षा, what are you doing? It does not look nice. सर नहीं, मैं चेक कर रही थी कि उन्होंने वेग लगाई है, ये असली है. मैंने कहा मैंने तुम्हें बताया था आ जाएंगे. नहीं, मैं फिर भी चेक कर रही थी. So now when she came for follow-up, so I said, Akanksha, can I click a picture of yours? I'll hide your face so that I can give courage to others who are going through the treatment, that life comes back to normal. She said, I think, doctor, I'm quite pretty. Don't hide my face. I want to be an ambassador and tell the world that breast cancer has to be detected early. So my only aim of coming today, I'm very conscious when I have to give these talks. I feel that I should not scare you. The only aim is to give you information, and I'm glad that the men folk also, kept sitting there. I'm sure you all have learned something which you can go and share with the women in the family. So thank you so much for your attention and time. And if there are any questions, I will answer them. Otherwise, we'll start with a practical demonstration of how self-examination we all must do. Excuse me. The model sticker वाला. ये लाइट भी चल रहा है. हाँ, तो बॉडी में.
Can I pose the question, madam?
Sure, ma'am.
Thank you for such a lucid, explanation of how, we can prevent ourselves by taking the right steps at the right time, by detecting at the right time. I have a small question in the sense that, as you have already mentioned that we need to do our annual checkups, and I happen to get my, because I generally don't do it annually, but I thought that was in 2023 that I should get it done. So it was an overall health checkup, and the mammogram was also conducted. And there were some lumps in the breast, so it required more investigation. So after investigation, I think they did, ultrasound also, then some more MRIs and things like that. So they say it's BIRAT 4, then BIRAT 3. So does it mean that because they say that it's not malignant? So what I do is every 6 months I try to go for an ultrasound and come back. But I think that with your whatever insights that you have given, and I'm looking forward to the demonstration also, that one will be able to constantly keep a watch rather than going to the hospital every 6 months. So, and I would also want to know that is it possible that there are ways of, getting over or away with this stages and come to zero ground level or not? This is one question which I would like to ask. Thank you.
So thank you for raising this important question. I'm glad that you are going for your health checkups, even if they are not annual. So, but at least you are doing it. That's right. So that means you are in the right direction. We all have to understand that medicine is not a perfect science. Mathematics is a perfect science. 2 plus 2 is always 4. Medicine is not a perfect science. That is why these grades are there. BIRATS 3, BIRATS 4. So at BIRATS 3 and BIRATS 4, no one can give you 100% clearance, which means you need to continue with your checkups. It might be nothing, but I would still say that ultrasound has no ionizing radiation. It is a harmless test. At least 2 ultrasounds should be done at a gap of 3 to 6 months. If you find anything suspicion, if still nothing is there, then go back to once in a year health checkup.
Ma'am, thank you for the presentation. Sorry. I have a very small question. The vaccines that you told us for cervical cancer, most of us are above 40. Yes. So there are two opinion about it, that you can still have it even though it may not be effective. So what is your, what do you recommend? Because most of us in this hall could be above 40. Do you think we should go for that, or now it's over age and we should not be taking it?
I feel that after the age of 40, there is little point in going for vaccination. I'll tell you the reason. We have to understand that how this infection vaccine is given. So after the age of 40, there is little point in taking the vaccine. I would rather recommend that all of us above the age of 40 years need to go for our pap smear, and pap smear has to be done, suppose, 3 to 5 years. Thank you. Test called PS. Accident, believe me. Sure. मैं पढ़ लूंगी, आप मुझे बता दें. इसमें आ रहे हैं, डिस्प्ले हो रहे हैं? हाँ, sure. Please.
ब्लैक कलर में वो ज्यादा एग्रीवेट करता है फॉर ब्रेस्ट कैंसर. इज इट ट्रू?
No, it is not true. Wired bra is also not a problem.
Okay.
सिर्फ एक ही चीज है कि कांस्टेंट ट्रॉमा नहीं होना चाहिए वायर का कहीं पे. अगर आपको लग रहा है कि वो कांस्टेंट ट्रॉमा कर रहा है, कहीं प्रेशर कर रहा है, इट हैज टू बी द राइट साइज, राइट फिट. अदरवाइज कांस्टेंट ट्रॉमा हैज टू बी अवॉइडेड, दैट्स ऑल.
So we have a few questions from the online participants as well. The first question is, are there any side effects of mammogram?
So very good question has been asked कि मैमोग्राम का कोई साइड इफेक्ट है क्या. सो मैमोग्राम जो है, जब हम मैमोग्राम करते हैं तो कुछ फॉर्म ऑफ एक्सरे जाता है हमारी बॉडी में. हम लोगों को सबको याद होगा कि पहले हम फोटोग्राफ खरीदते थे, वो छोटा सा एक कैमरा आता था, फिर फिल्म प्रोसेस करवाते थे. अब हम क्या करते हैं, हमारे पास फोन में कैमरा होता है. फोन में जो कैमरा होता है उसको हम पोस्ट प्रोसेसिंग करते हैं. सिमिलर थिंग हैज हैपेंड इन मैमोग्राम. मैमोग्राम पहले करते हुए रेडिएशन एक्सपोजर बहुत ज्यादा होता था, विच हैज बीन रिड्यूस्ड टू ऑलमोस्ट 1/10. सो अगर हम रिस्क बेनिफिट रेशियो देखें, सो द बेनिफिट इज फार मोर देन द रिस्क और साइड इफेक्ट ऑफ मैमोग्राम. मैमोग्राम हैज टू बी डन. ये हमारे यूनिवर्सल हेल्थ प्रोग्राम में अभी तक नहीं आया है बिकॉज वी आर अ लार्ज पॉपुलेशन. सो रिसोर्सेज का इश्यू हो जाता है.
The next question is, does studying breast cancer hold clues to solving other cancers or even aging itself?
So there are so many advances in the treatment of cancer, prevention of cancer, that definitely science is dynamic and we are moving in the right direction. I forgot to tell you one more thing. हम जब बात कर रहे थे अर्ली डिटेक्शन की, जब प्रोफेसर मागो ने उस चीज को पॉइंट आउट किया था, सो नाउ देर आर अ लॉट ऑफ विमेन who are diagnosed with breast cancer at such an early stage that they do not require chemotherapy. They do not have to go through the trauma of chemotherapy, which is such a good thing. All this is possible because of early detection of breast cancer. And पहले हम breast cancer को एक नजर से देखते थे. Now breast cancer is several types, A, B, C, D. So उसके बेसिस पे हम डिसाइड करते हैं किस टाइप का है, किसको कीमो चाहिए, किसको नहीं चाहिए. So that is the development in science on aging, cancer, treatment, etc.
Ma'am, the next question is, could artificial intelligence, or AI as we call it, help in detecting breast cancer at an even easier stage than current methods?
We are all waiting for the day, we are all waiting for those studies to come. It is not very far away. अभी क्या हो गया, जैसे एक्सरेज होते हैं, सीटी चेस्ट होता है, सो उसको डॉक्टर तो रीड करता ही है, प्लस एआई भी रीड करता है. सो सपोज ह्यूमन आई 2 मिलीमीटर को लीजन को देख सकती है, तो AI जो है वो 0.2 को देख सकता है. So AI will definitely revolutionize the space of early diagnosis.
Okay, ma'am. So the next question is any foods which can prevent cancer and also to be avoided.
Okay, so the question is about food choices. We have to limit the जो हम non-veg food लेते हैं, especially red meat, has to be taken, in a smaller quantity. Excessive fat is bad. Processed food is bad. जो हम लोगों के सबके इंडियन के किचन में बनता है ना, रोटी सब्जी दाल चावल, that is best, that is safest. If we have a pimple on breast, is it normal? Does sagging breast has any chance of cancer? Okay, so there are 3 questions. First is pimple on the breast. Pimple on the breast is normal. बहुत सारी चीजें इस तरह की swellings normal होती हैं. You do not have to worry. Sagging breast does not have an increased chance of cancer. One should consider wearing a bra because the breast has to be supported. Not wearing bra is not advisable. So I think we are done with the questions. So we'll start with the practical demonstration. Yes. Is okay. Is okay. Is okay. तो जब हमें अपने आप को देखना है तो हमें ये याद रखना है कि नॉर्मली हमारी जो ब्रेस्ट होती है वो सिमेट्रिकल होती है, शेप साइज और कॉन्टूर में. वेन एवर यू आर लुकिंग एट योर सेल्फ, डोंट लुक डाउन. ऑल ऑफ यू गर्ल्स लुक हियर, वी ऑल हैव टू टॉक अबाउट इट. सो जब हम वेन एवर वी आर लुकिंग एट आवर सेल्स, इट हैज टू बी अ वेल लिट रूम और बाथरूम. लाइट अच्छी होनी चाहिए ताकि आप अपने आप को देख सकें. देयर शुड बी अ लार्ज मिरर. हमें ये देखना है कि ब्रेस्ट में कहीं ब्रेस्ट अंदर तो नहीं जा रही है, कहीं कोई बाहर प्रोजेक्शन तो नहीं है, कहीं कोई रेडनेस तो नहीं है, ऐसा तो नहीं है कि एक ब्रेस्ट का साइज सडनली इंक्रीज हो गया है. हमें ये सब चीजों को ध्यान रखना है. When we have to look at ourselves, we have to look at ourselves in 3 positions: arms by the side, arms on the waist, and arms raised above. ये arms raised above क्यों करते हैं? We are trying to see when we are raising arm, are both the breasts getting lifted up equally or not? That is the idea. या कभी कभी ऐसा होता है कि कोई डीप लंप या ट्यूमर होता है तो आर्म रेज करने से वो प्रोजेक्ट आउट होकर हमें दिखने लगता है. ठीक है. सो द फर्स्ट स्टेप इज लुक एंड देन वी हैव टू फील आवरसेल्व्स. व्हेन वी हैव टू फील आवरसेल्व्स, देयर आर 2 पोजीशंस. या तो हम शॉवर लेते हुए कर सकते हैं या लेट के कर सकते हैं, जिस भी पोजीशन में आपको कंफर्टेबल लगे. राइट हैंड फॉर लेफ्ट ब्रेस्ट, लेफ्ट हैंड फॉर राइट ब्रेस्ट. क्या नहीं करना है, हमें ब्रेस्ट को कभी भी ऐसे होल्ड करके नहीं टेस्ट करना है. हमें अपनी पैड ऑफ 3 फिंगर्स यूज करना है, इस तरह से फील करना है. हमें एक सिस्टमैटिक मैनर में करना है. सिस्टमैटिक मैनर का क्या मतलब है? रैंडमली नहीं, यहां कर लिया फिर यहां कर लिया, नहीं. हम एक जैसे सपोज 6 o'clock पोजिशन से शुरू करते हैं, इनर सर्कल बनाएंगे. यहां पे हम कंप्लीट करके इस इनर सर्कल को फिर हम एक आउटर सर्कल बनाएंगे. हमें ये समझना है कि हमारी जो ब्रेस्ट है वो हमारी कॉलर बोन तक आती है. ये हमारी कॉलर बोन है. सो यहां तक भी आके हमें इसको फील करना है. लास्ट में हमें अपना आर्मपिट में फील करना है कि यहां कोई गांठें तो नहीं है. फिर हमने अपनी कॉलर बोन के ऊपर यहां पे फील करना है कि यहां कुछ एबनॉर्मल तो नहीं है. कब करना है? पोस्ट मेनोपॉजल विमेन कैन फिक्स अ डे, फर्स्ट सैटरडे, फर्स्ट संडे, फर्स्ट ऑफ एवरी मंथ. प्री मेनोपॉजल विमेन जहां रेगुलरली पीरियड्स हो रहे हैं वहां पे हमारे को 5 to 7 days आफ्टर आवर पीरियड्स आर ओवर तब करना है. ठीक है. सो अब ये जो मॉडल्स में लेके आई हूं इसमें भी बहुत सारे मॉडल्स हैं. आई जस्ट ओपन. तो अभी आप सबका एक एग्जाम होगा जहां पे आप एक एक करके आएंगे, इसको फील करेंगे ताकि आपका माइंड में आपको क्लियर हो कि आपको क्या फील करना क्या है, कैसा फील होगा जो एबनॉर्मल है. तो ये जो मॉडल्स हैं इनके अंदर एक्चुअली लम्प्स हैं जो हिडन। आई वांटेड टू शो यू दिस। ये मैं आपको एक्सप्लेन करने की कोशिश कर रही थी कि अब इसमें निपल जो है अंदर चला गया है, सो दैट इज एबनॉर्मल। हम सबके घर में ग्रैनीज हैं, जैसे जैसे एज होती जाती है तो ब्रेस्ट थोड़ी अट्रोफी हो जाती है, श्रिंक हो जाती है, दैट इज नॉर्मल। बट अगर किसी का ब्रेस्ट सडनली एक ब्रेस्ट श्रिंक हो रहा है, वो अंदर की तरफ जा रहा है, उसका जो स्किन का सरफेस है वो ऐसा लग रहा है, इसको हम कहते हैं ऑरेंज पील अपीयरेंस, संतरे के छिलके जैसा अपीयरेंस हो रहा है। तो अगर लंप फील नहीं भी हो रहा, गांठ फील नहीं भी हो रही, तो भी हम सबको जाके डॉक्टर को मिलना है, ठीक है। सो आई सजेस्ट कि आप 10 ऑफ यू कैन कम। लेट्स स्टार्ट विद द पीपल इन द फ्रंट रो। मैम आप लोग आ जाइएगा। एक चीज और मैं बता देती हूँ कि कभी कभी क्या होता है कि हम विमेन ना, वी हैव अ टेंडेंसी कि हम जब बेबीज को फीड करते हैं तो थोड़ा राइट आर्म में ज्यादा पकड़ते हैं, तो लेफ्ट ब्रेस्ट से ज्यादा फीड किया जाता है, या कभी उससे हमारी ब्रेस्ट के साइज में थोड़ा सा डिफरेंस हो जाता है, या कभी कभी बाय बर्थ भी होता है, सो दैट इज ओके। या सपोज किसी का बाय बर्थ या फॉर अ लॉन्ग टाइम निपल नॉर्मली अंदर है, दैट इज ओके। व्हाट वी हैव टू आइडेंटिफाई इज द चेंज इन द ब्रेस्ट, ओके।
When we breastfeed, then there's sometimes the lymph nodes, they bulge out. So that is normal.
That is normal, but then they disappear also with time. But if anything is persisting,
Persisting for a long time, but soft, not hard or anything. Oh, right.
One common question, I don't know, this could be for many women, young girls. Should you remove your brazier before you go to bed? Does it or doesn't has any effect on?
I feel it is always very nice to speak to teachers. It is very nice to speak to women. हम लोग सब सोशल मीडिया पे हैं, सब लोग हैं ना, लेकिन हम कुछ यूजफुल इन्फॉर्मेशन भी शेयर करेंगे, नॉट ओनली अबाउट द फूड दैट वी ईट और द ड्रेस दैट वी वेयर और द ज्वेलरी, यू नो, वी हैव टू टॉक अबाउट मोर मीनिंगफुल थिंग्स इन लाइफ। मैम लेट्स स्टार्ट विद, आइए मैम, करिए। मीनाक्षी मैम, आपका नाम याद हो गया है? अरे आप तो फर्स्ट अटेम्प्ट में ही पास हो गई, और भी हैं, करिए मैम। मैम आप लोग भी आ जाइए, कुछ और लोग भी आ जाइए, आ जाओ। आई रिक्वेस्ट ऑल ऑफ यू कि कोई भी किए बिना मत जाइए, आपका हेजिटेशन खत्म हो जाएगा। वेरी गुड। सो आई वांट टू एम्फसाइज वन मोर थिंग हियर, यहाँ पे
छोड़ दीजिए कैमरा का फोकस आता है,
ताकि मतलब आपको ये ध्यान रखना है कि जहाँ पे ब्रेस्ट का माउंट ज्यादा है ना, ब्रेस्ट टिश्यू ज्यादा है, वहां आपको ज्यादा प्रेशर लगाना है। जहाँ पे ब्रेस्ट टिश्यू ही कम है, वहां पे कम प्रेशर लगाना है। स्टार्ट करिए यहाँ से। एनीथिंग? हाँ, गुड क्वेश्चन, गुड क्वेश्चन। So somebody is saying that there are always lumps. Breast has to be lumpy because there is a lot of fat in the breast. Yes. So what we have to look for is any change. Suppose कोई breast lump है जो जब टच करते हैं तो यहाँ से वहां चला जाता है, वहां से यहाँ चला जाता है, तो वो कैंसरस जनरली नहीं होता। एक और चीज, ब्रेस्ट कैंसर के लम्प्स जनरली पेनलेस होते हैं अनलेस ब्रेस्ट कैंसर बिकम्स वेरी एडवांस्ड, है ना। सो डोंट गो बाय द पेन। मैम कुछ ऐसे भी ब्रेस्ट हैं जिनमें मल्टीपल लम्प्स है, तो रुकेंगे नहीं, करेंगे और आगे बढ़ेंगे। कैसे मिस कर गए? हाँ बिल्कुल ठीक, परफेक्ट। तो हम सब लोग करेंगे, ठीक है ना। आओ बेटा। और अपने बच्चों को भी बताएंगे, हम अपने कजिन्स को भी बताएंगे, अपनी भाभियों को, सिस्टर्स को। दिस इंफॉर्मेशन हैज टू बी शेयर्ड। हाँ, तो ये जो स्किन ऐसी हो गई है, ये भी ब्रेस्ट कैंसर का ही एक साइन है, और निपल अंदर चली गई। That's normal. कोई बात नहीं, that's okay. हाँ नहीं, कोई इशू नहीं है। चॉइस है आपकी, आपकी मर्जी, जैसे आपको ठीक लगे। नहीं नहीं, कोई बात नहीं, नहीं सपोज किसी को नॉन कैंसरस ब्रेस्ट लम्प डिटेक्ट होता है तो उसमें कोई चिंता की बात नहीं है, वो नॉर्मल है। जैसे सबको कराना चाहिए वैसे ही उनको कराना चाहिए। आपने साल में एक बार जैसे चेकअप कराना है वही करवाना है, साल में एक बार, वंस इन अ ईयर। आ जाइए, आ जाइए। हाँ हाँ हाँ, कोई इशू नहीं है। नहीं, अच्छा, तो कभी कभी हमारा नॉर्मल भी होता है ना, हमारे दो हाथ ही देखें तो थोड़े से अलग होते हैं। हाँ, जिनका हो गया है वो प्लीज हट जाएं, जिन्होंने कर लिया है। बिल्कुल ठीक पकड़े, सही पकड़े हैं, सही पकड़े हैं। अब ऐसे ही खुद को एग्जामिन करना है। हाँ, तो अलग अलग मतलब यहाँ पे जो ब्रेस्ट में स्किन अंदर चली गई है, पूरी अंदर पुल आउट हो गई है ना, निप्पल भी पूरा अंदर चला गया है। हाँ, ये भी ब्रेस्ट कैंसर का एक साइन है। बेटा है, ये ब्रेस्ट लम्प ही है। हाँ, मैं हट जाती हूँ, आइए आप लोग आ जाइए। हाँ, अब लगवाओ 3 डोजेस। दैट विल बी योर बेस्ट गिफ्ट टू योर डॉटर। वो अपनी बेटी को आपका बेस्ट गिफ्ट होगा। आज से 1 महीने बाद और आज से 6 महीने बाद 3 महीने। कोई बात नहीं, वो थोड़ा सा पीरियड्स और हार्मोनल चेंजेस के कारण भी होता है। It is generally not advisable to not wear bra. It is always advisable to wear a bra ताकि ब्रेस्ट को प्रॉपर सपोर्ट मिलता है। नाइट में इट्स अ डिफरेंट थिंग, बट डे टाइम में तो पहनना चाहिए। इट्स अ गर्ल सर्टेनली मस्ट वेयर ब्रा। पहन सकते हैं, मैम इरेलेवेंट बात नहीं करेंगे, जो भी रेलेवेंट क्वेश्चन है पूछ के आगे बढ़ेंगे। हाँ।